The McShin Foundation is Virginia's leading peer-to-peer recovery community organization. So if you or a loved one is struggling with addiction, let us get you connected. Build your self-esteem and lead you to a solid foundation in your recovery. Check us out.
Good evening, everybody. John, thank you for the introduction. But more importantly, thank you for what you're doing to help so many people. You all, the Authentic Recovery community, it's great to be among my friends here in the recovery community. And thank you for the opportunity to share with you some of the things that we've been doing to help combat the heroin and opioid epidemic that's touching the lives of so many families all across Virginia and across the nation. And first of all, I want to say how much you all have taught me about how addiction and substance use disorders can affect folks from all walks of life, and how important it is to have that community support. And it's been your input and your expertise that has really been integral to the work that we've done in the Attorney General's office and to the work that we're going to continue to do. So first of all, we've taken a really multifaceted approach to this, combining enforcement with education, prevention, legislation, and encouraging the expansion of treatment and recovery. And we have been relentless in going after the dealers and the traffickers who profit off addiction and who put these poisonous drugs out on the streets. And my team and I have increased prosecutions of dealers and traffickers to record levels. We've worked 90 cases involving 435 pounds of heroin, and that's a lot of daily doses, let me tell you, and worth a lot on the streets. But just like the previous speaker who talked about the doctor from 1936, we have understood from the very beginning that this was not a problem that we were going to solve just with arrests. And supply side solutions are only going to go so far. We've got to really focus on the demand side as well, and that's where we've done some of the work that I've been most proud of. We really honed in on education and prevention, specifically targeting young people. And we've added heroin and prescription drug module to our Virginia Rules program. And that's basically a law-oriented program out of the Attorney General's office that helps kids stay out of trouble and helps them make good decisions as they're growing up. And it's targeted to the later middle school and early high schoolers. And it's really when kids need to hear about the risks and dangers of these drugs. We also created a documentary called Heroin, the Hardest Hit that John talked about. It features a lot of our friends at McShin, Honesty, David, Brandy, John, others that are here tonight. And what we wanted to do with that is really give folks a chance to tell their own story. We didn't want to just have some voice of authority saying, drugs are bad, don't do them. Instead, what we wanted to do is to give folks a chance to tell their own stories, to talk for themselves. And so when you watch the documentary and the video, you'll hear them talk about how far their lives got off track before they found treatment and a recovery plan that worked. And you hear from the friends and the family members of some of the folks who unfortunately lost that fight. If you've seen the documentary, you'll meet people like Caitlin Weems and her mother, Carolyn. Caitlin was a 21-year-old mother of one from a perfect family in Virginia Beach. She was an incredible soccer player, really gifted and talented, but after some back injuries and dental injuries, she went on opioids as a teenager, and they slowly consumed her life. And she overdosed, and she died, leaving a 1-year-old baby that's now being raised by her grandparents. And I've heard so many stories just like that. And I imagine some of you out there can probably relate to very similar stories. And as a parent myself, stories like that scare me to death, because my daughter, who's here tonight, is the same age that Caitlin Weems would have been. And I know how quickly and severely that fall can happen. And I've heard so many stories like that. It just is what helped compel us to make the documentary. And it's really a centerpiece of that education and prevention effort. And if any of you are interested in it, it's available online at hardestHitVA.com. It's online to watch, but if you want to show it to groups, we're giving out DVDs. We really want as many people as possible to see this and have access to this important tool. It's already being shown as a part of the health curricula in schools from Tazewell to Virginia Beach to Winchester, and we're working to incorporate it into schools all across the Commonwealth. We also put together new legislation, a bipartisan package of new laws to help address the problem and literally save lives. And they were enacted into law with bipartisan support. Politics right now seems so divided. But when we came forward with some ideas about this, it got bipartisan support. This is something that the entire legislature came together and worked together on. What we did was make sure that naloxone was available to all first responders in the state, because during an overdose, seconds really matter. And administering naloxone can truly mean the difference between life and death. And now more than 84 law enforcement agencies have their officers trained to administer naloxone and to carry it. And this is something that is really saving lives. We also got the state's first Good Samaritan law, which encourages people who are in the presence of someone having an overdose to call 911 and stay for help without having to worry about getting in trouble themselves. And so, there's so much more, though, that we're doing. We've sought sanctions against more than 260 medical professionals for opioid-related infractions. And we've partnered, and we're part of a bipartisan coalition of state attorneys general from across the country in an ongoing investigation to evaluate whether the pharmaceutical manufacturers have engaged in unlawful practices in the marketing and sale of these drugs. And that's just some of what we've been doing, but we know that there's so much more that still needs to be done. And we've got an approach that evolves and advances in response to an epidemic that is always changing and exhibiting new trends. This epidemic looked different a year ago, and it's going to look different a year from now. And we've got to respond accordingly. And that's why a few weeks ago I laid out some new priorities and initiatives that can allow us to continue to address this crisis. And these new priorities fall into several categories: law enforcement initiatives, support from the medical community, and recovery, treatment, prevention, and education. So when it comes to law enforcement initiatives, we need new laws to crack down on fentanyl. This is a drug, we need a drug-induced homicide law and a way to monitor naloxone pricing. And when it comes to support from the medical community, we need to incentivize alternatives to prescribing opioids in the first place. We need to make our prescription monitoring program mandatory when it comes to opioids and build stronger relationships between emergency rooms, first responders, and the authentic recovery community. Virginia recently established a peer recovery specialist registration for individuals who have successfully entered long-term recovery and have now been trained to assist others in their recovery. And so each emergency room, law enforcement agency, regional and local jails, all should establish relationships with the recovery community, including one or more peer recovery specialists who can be made available to an overdose victim or a drug user who enters the emergency room, interacts with law enforcement, or is incarcerated. And these specialists who have gone through recovery themselves can connect with overdose victims or drug users in a way that nobody else can, because they've been there. And they can share their stories of recovery and hope. And when it comes to recovery, treatment, prevention, and education, we need to incorporate heroin, opioid, education, and prevention into middle and high school health curricula. Engage insurance companies in solutions, and eliminate barriers to treatment. So let me dig a little bit deeper at those. First, incorporating education and prevention into middle and high school curricula. As I said before, my documentary, Heroin, the Hardest Hit, has already been incorporated into 9th grade health curricula in localities from Hampton Roads to Winchester to Tazewell. And we should make this education and prevention a part of high school health curricula all across the Commonwealth. But I have heard from so many of you that high school is too late, and it really needs to be a part of middle school as well. And showing Heroin, the Hardest Hit in middle schools would complement the DARE program that's already running, and I think it could go a long way to helping to teach our children the dangers of opioids and heroin. And we can incorporate this into our curricula, either with a new statute or through regulations from the State Board of Health. We also need to engage insurance companies in addressing this epidemic by ensuring that they treat substance use disorder as a health crisis and provide coverage for necessary treatment and recovery services. My fellow state attorneys general and I, so I'm working with a number of other state attorneys general to explore ways to get insurance companies to commit to measures like increasing the number of insurance plans that cover substance use disorder, extending the number of days of treatment that can be covered, removing pre-authorization requirements for addiction treatment, coverage for medical assisted treatment, and tighter controls on reimbursement for opioid prescriptions. And because of an antiquated, decades-old rule, Medicaid places a restriction on the use of funds for residential inpatient substance use treatment. And I'm part of a group of state attorneys general that have asked Congress to pass federal legislation that would remove this unnecessary restriction, and that would make treatment more accessible for those who need it. So those are some of the next steps that Virginia can work toward, and some of the work that I've done as Attorney General to help combat this crisis, and some of the things that I plan on doing if I'm privileged enough to earn a second term. And I want to close tonight on an optimistic note, and that is hope. The hope that I see in this room tonight, and the hope that I see from all of you for the work that you're doing in the recovery community every day. I can't begin to imagine what it must feel like to wake up in the morning and feel ashamed because you feel powerless over an addiction that you hate. Or what it must feel like to wake up and know that your child or your spouse, the person you love the most in the world, is suffering and you don't know where to turn. And so often, shame and stigma or fear can force families and those with substance use disorders to suffer in silence. But we cannot and we will not let ourselves become hopeless or discouraged. We have to make sure that the people who are struggling know that you can beat addiction. There is life after addiction. There is hope in recovery. Good people struggle with this disease. And when I'm sitting in a living room or a recovery meeting at McShin, I don't see bad people. What I see is people with big hearts who have been touched by a disease that could affect any one of us. That's what I've been seeing. And I see people who are doing the absolute best that they can to deal with a disease and drugs that are incredibly powerful. I see people who deserve to be treated with respect and who should find a community of support when they show the courage to ask for help. So I want to thank you very much for having me here tonight. I look forward to continuing with you in the weeks and months ahead. And again, thanks so much for having me.